Okay, so I think we're just about ready to get started. Welcome all. Thank you very much for joining us today for our workshop on demystifying testing. My name is Kate O'Brien. I'm a partner in the Finn Partners Travel Practice. I think it's fair to say that there's been lots of confusion in the market regarding COVID testing. So today our client GeneMe UK, an authorised distributor of the Frank test, has very kindly offered to share a bit of an overview of the testing landscape, explain some of the differences between the types of tests available, and importantly, the role of technology in accurately and securely providing those test results. I think the ever-changing quarantine and air corridor rules have, as we all know, resulted in huge levels of uncertainty, leading to very few travel bookings. But hopefully this week's announcement from the government that quarantine time will be cut to 5 days is hopefully a promising one. So I'm joined today by Angus Urguhart, Sales Director of GeneMe UK, and Gavin Watts, Client Transformation and Delivery Director of Yoti. I'll be handing over to both of them to take you through, I guess, a bit of a 101 on the testing landscape very shortly. But in terms of housekeeping, we will have some time at the end of the session for a Q&A. So please do pop your questions in the Q&A box at the bottom of the screen, and Angus and Gav will do their best to get to as many as possible. So without further ado, I will hand over to you, Angus and Gav.
Great, thanks very much indeed, Kate. I'm just going to share my screen. So great. So good afternoon, everybody. My name is Angus Urguhart, and I'm Sales Director at GeneMe UK. We're a COVID testing company based here in the UK. And if there is such a thing in this landscape, I think it's reasonable to say that we're certainly among the elder statesmen of that particular new industry, as we've been actually involved in point of care testing, working with employers since the summer. So we have gained a great deal of experience about COVID testing, how it works. We've pulled together a team of scientific experts as well over the period of time to really give us advice and make sure that we're doing all we can to work in a correct manner, but also to use the science to underpin everything that we're doing. So we do have a great deal of knowledge about this space as well, and obviously we work with Yoti as well, and we're here to explain to you what we've learned and to give you some of the takeaways, and just really to hopefully demystify the entire testing landscape for you. I'll just hand over to Gav to make an introduction to himself as well before I begin the presentation.
Hi, good afternoon all, and thanks for taking the time to listen to both Angus and I this afternoon. Angus is really going to kind of dive into the testing elements themselves, the different types of tests, the applications within might be used, and then I'll come at it from an angle of very much how that can be combined with somebody's identity and other travel information to effectively drive benefits downstream of somebody actually taking the test.
Great, fantastic, Gav. Thanks very much indeed. So we'll just move on to the first slide. So what we want to do here really is to give you a bit of an overview about what's been happening in the world of testing so far, how the land lies for travel and tourism, and what the future can hold. Throughout the presentation, we'll talk about where we are at the moment, what we think is going to be happening, current technologies, what tests are available, how they can work, what they're suitable for, and talk about some ideas in terms of how you can use testing to reopen travel, basically. And I think one of the key things about testing really is that how it can be used as a key strategy for trying to get life back to as normal as it possibly can be under the circumstances. And really be sort of like make things safe for people as much as possible. I'm sure everybody's heard lots of information and news about the vaccines coming forward, which is great news. But I think it's very important for people to understand that, you know, there's still a relatively long road to walk in the vaccines. It'll be great for them to come forward, people start to get vaccinated. But, you know, you have to look at a scenario where you have to fully understand how vaccines work correctly. Will people still be contagious? Will people need to be vaccinated multiple times, such as a flu jab, where you have to have annual jabs, or in some cases people have speculated it could be as much as soon as 6 months. You have to get to a certain number of people vaccinated before you get to a point where COVID ceases to be a thing anymore. So basically the reality behind it is that testing is one way that you can ensure that you are keeping people as safe as possible, and you can have life returning to as normal as possible, whilst you build up to a point where basically, hopefully, we'll be able to say that COVID is very firmly in the rear view mirror. There's been lots of information recently about, which has been finally published on the 24th of November, about the fact that the UK government is now going to allow a test to release quarantine regime that will take effect from the 15th of December. This obviously is great news for the travel industry, because it does provide an opportunity to minimise that period of quarantine and hopefully get more people traveling. And we'll talk a little bit about that and how that can impact and work upon things. What's very good news is that as part of that testing regime, the government have accepted that LAMP technology can be accepted. I'll talk a little bit further about what LAMP technology is and how important that is in travel. But we feel that it's an absolutely critical part of travel, because you have accurate testing, but that is also that can also be scaled and is much quicker than PCR testing, which we'll talk about in more detail. But that's a really big step forward, that the British government have acknowledged that LAMP testing is actually a test that should be used as part of this process. The challenge that always exists when you're dealing with testing is that you have to balance the accuracy of a test along with the speed of getting it done, and actually how scalable that is. And it's a big problem, and particularly a big challenge when you're looking at the travel marketplace. You know, and so LAMP testing is something which certainly helps within that space. And because it gives you an accurate test that can be done at speed, and has further options as well to look at something which we call pool testing, which again I'll talk about in more detail later on. But pool testing allows you to actually test a number of samples together in one test, which improves throughput of tests very significantly, but crucially also lowers the cost, because cost is obviously a key factor in travel, well, in fact in all testing, but particularly in travel. You really have to look at the most cost-effective way of doing this, but at the same time you can't sacrifice too much accuracy in doing that. So pool testing is actually a way of lowering tests significantly down. And we have actually been talking to various people about how we can do this to open up different destinations. So we'll take a little bit of a deeper dive now into the tests that are currently available, and how they work and what they're suitable for. There's three key types of tests essentially that are on the marketplace, that are commonly used on the marketplace at the moment and relevant to our conversation today. The first one is antigen testing, often referred to as rapid testing. This basically is a relatively new technology which has been developed relatively recently. The advantage of antigen testing is it does not require lab processing, so it can be carried out as a point of care test, and it can be very quick, and it is relatively cheap. The big drawback of antigen testing is it is not very good at all at finding the virus in people that do not have symptoms, otherwise known as asymptomatic people. As I'm sure you can appreciate, when you're testing, the purpose of your testing is to test everybody coming to a certain place in order to see whether they are carrying the virus or not, to let them into an area, it's vitally important that you use a test that can identify people that do not have any symptoms, because obviously the vast majority of people that present themselves to that place to be tested won't have any symptoms. So antigen tests, unfortunately, are not very accurate at doing that at all. There's lots been written about that, particularly by WHO and the British Medical Journal recently as well. But they do have a place to play within the testing landscape. They can be very useful for governments to use them as part of screening programs where people are coming to the government. So when somebody has symptoms and they go to NHS test and trace and they say, I have a cough, an antigen test can be extremely useful for very quickly giving that person to establish, do they have the virus or do they simply have a cold or a flu? So they certainly have a place, but they do not have a place when you are trying to screen people that do not show symptoms. RT-PCR testing is the second one to look at. That's the one that I'm sure many people have heard of and would know about. These are the tests that get carried out in a lab, and are currently the vast majority of tests being done by the government fall into this category of RT-PCR. As I said, they require lab processing. They are very accurate. They do pick up the virus in people without symptoms. They're very good at doing that. And they're a very good way of confirming a diagnosis. But as I said, the big drawback with the PCR test is that it has to be sent away to a laboratory to be processed, which means that you are, realistically, you're looking at, if you're fortunate, a 12-hour delay in that process. In reality, it's often been 72 hours before people have had results when they've been getting tests from the NHS, because you only have a finite amount of lab space available sending tests through. So it's not a scalable test. They also tend to be very expensive as well. I was in fact told by a client yesterday that someone was trying to charge them over £300 for a single PCR test on Tuesday of this week. So the price is definitely far more significant. Now, RT-LAMP is the third type of test we'll talk about today. This does not require lab processing such as an antigen test does, but it has a similar level of accuracy to a PCR test. Essentially, what happens with an RT-LAMP test is that a sample is taken via a swab from the person who's being tested. It then gets put into a tube that contains a certain amount of chemicals in that tube. A liquid buffer is then put into the tube, which creates a chemical reaction which you then put into a PCR machine. You run a cycle that takes approximately 30 minutes. And then at the end of that, there is an output from the machine that basically says whether somebody is positive or negative. So it actually works by the amplification of the virus. I'm not going to go into too much science on this call at the moment, and there's plenty available, and certainly there's plenty available that anybody who's interested, we can provide after the call to lots of information regarding that. But essentially it works on the amplification of the virus, and it's a very accurate test. It's a very good test because it gives you a nice balance between accuracy and between speed. In fact, some RT-LAMP tests, such as the Frank test, for example, have very, very high levels of accuracy and certainly compare very similarly to a PCR test. But it does give you the ability to have the opportunity to screen people at an airport, for example, before getting onto a plane. After they've been, when they come back into the country, they can go somewhere and get a test, but it gives people the ability to get a test results far more quickly than an RT-PCR test does. So that explains a little bit about the different types of tests that we're talking about. The next slide here is interesting. It kind of links back into what I was saying before, but it provides a very good visual understanding of what happens with the virus and where the different tests come into play. Essentially, it talks about the incubation period. The virus can be, you can be looking at anything from 21 days down before where you have the virus before you actually show symptoms. But typically, you're probably looking at a 10 to 15 day period before you have the onset of symptoms where you're carrying the virus. As that period of time moves closer and closer and closer to the onset of symptoms, what they call your viral load, which is the amount of virus that you have within you, increases and increases and increases and increases. As a result of that, the closer you get to being to having symptom onset, the more contagious you become. But you can be very contagious a significant period of time before you have an onset of symptoms. This is why it is so important to have a test that is accurate enough to pick people up before the onset of symptoms. You may well have heard the expression super spreader. A super spreader is an individual essentially who is highly contagious, does not know that they have the virus. Indeed, some people carry the virus and don't show symptoms at all, potentially. That has also been known. So you can have a situation where somebody is carrying the virus, spreading it all over the place to people they're coming into contact with, but they're completely oblivious to the fact that they've got it. And so that's why you've got to look at using a test that can pick that up. This particular chart shows the life cycle of the virus, and then it also shows where the different types of tests can pick people up. So you've got the PCR tests, you've got the LAMP test as well, that basically sort of far more accurate and can pick people up, relatively early on in the journey. You've then got the antigen test, which really is only suitable for when there is an onset of symptoms. You can see here there's a clear window where an antigen test is going to miss people potentially who, or has the ability to miss people who have the virus but are not showing symptoms. And then one test I didn't mention, but I will mention very quickly, is an antibodies test. An antibodies test has no place whatsoever in terms of working out whether somebody has the virus before they show symptoms. An antibodies test is used to discover whether someone has antibodies to COVID-19 in their blood post-infection, basically. So ironically, it will become quite a useful test, I imagine, as we move into vaccinations, because then it will be a way of telling how effective or not the vaccine has been with people. But it doesn't have any, if you have heard of antibodies tests, they don't have any role to play whatsoever in screening people for travel, basically. Several things to look at when you are looking at the world of testing. Obviously, World Health Organization, very important body for global health. They have certain tests that they define as being gold standard. A PCR test is defined as gold standard. A LAMP test, which uses amplification, or an NAAT test, as they are known, is also a gold standard. These are the only two tests which are deemed by WHO to be gold standard for looking for SARS-CoV-2, and so it's important when looking at any test that's being utilised that it is a WHO gold standard test. There are other markings that you will often see typically when looking at tests. CE-IVD, that's something which basically indicates that a product meets certain requirements sold within the European Union. It requires a manufacturer to have its products reviewed by independent regulated labs called peer reviewed, so that when they basically declare that they have CE markings for their product, it has been independently verified, essentially, by third parties to show that the science does stack up, basically. Things like ISO is important for the manufacturing processes that are involved in people that are manufacturing kits of this ilk, and you have local regulatory bodies as well. But an important point to look at when looking at testing and when looking at COVID tests is really to make sure that you're working with a manufacturer and with a supplier which is reputable, which has solid independent science from well-respected bodies to back up their claims. There's been a plethora of people coming to the marketplace with all sorts of different tests, and very, very important to go back to the science and look for the verification and the pedigree of any test which is being suggested could be used. UK government have set minimum standards for the test to release programme, which is will be live from December the 15th. Sensitivity of at least 97% and specificity of at least 99%. Specificity means how likely a test will be to be able to pick up whether someone has SARS-CoV-2. So if you have 100% specificity, it means it's 100% accurate at detecting whether somebody has SARS-CoV-2, which is what basically known as false. So that eliminates false positives. Sensitivity is basically how accurate it is at picking up whether somebody is infected. So basically, if you were to have 100% sensitivity, then you would in theory not get any false negatives. So if you have 97% sensitivity, there's potential for 3% false negatives coming through. Limit of detection is actually the most important yardstick when looking at the numbers behind tests. Most tests you come across will claim very high sensitivity and very high specificity. I've rarely seen a test that doesn't have a very high numbers for that. The reason being that particularly tests that come from perhaps markets outside of the EU, you can carry out a test in lab conditions and you can get certain results from that test, which can give you certain findings. There's a big difference between a test which is being proved to work in the real world when dealing with real people in a real testing environment very often, and tests which have been carried out in laboratories and make claims. Limit of detection is a critical yardstick, because that basically shows how accurate a test is in picking up people that have the virus. In simple terms, a limit of detection is utilized to see how much virus somebody is carrying. So the lower the limit of detection a test has, the better that test is going to be at picking people up who have relatively low levels of the virus. These are the people who are basically pre-symptomatic, as we explained in the previous slide. As the virus travels through someone in the life cycle, they obviously get the viral load becomes heavier and heavier and heavier, and then the easier it is for the more inaccurate test to pick those people up. So the lower the limit of detection, the better the test. This is really, really key. The method used to define limit of detection is called copies per millimeter. This is copies of the virus, because the virus replicates itself within a person. So it's a standard method for talking about what the limit of detection is for a test. And the government has basically said that that has to be less to or equal than 1,000 SARS-CoV-2 copies per millimeter. This will incidentally knock out a large number of tests that are currently in the marketplace, because their limits of detection are not actually as accurate as that. In the case of Frank, the test that we work with, we have an LOD that's actually less than 200 copies of the virus. Some studies have actually found it to be as low as 20. So we have a very, very accurate limit of detection. And it needs to have had at least 150 positive clinical samples and 250 negative clinical samples as well. So the government are making sure that the tests available really do meet the standards required. This was mentioned before, but basically, who has recommended that antigen testing is not suitable for cross-border travel or for testing people who are asymptomatic? And the British Medical Journal actually recently wrote a paper. In fact, I think it was the end of last week, talking about some of the antigen testing that's been going on in Liverpool, expressing strong concerns as to the number of people who are going through the cracks, effectively false negatives, people that actually have later discovered to have the virus who were being tested as negative. One of the really dangerous things about having lots of false negatives with a test is not only can it cause the virus to spread, but it gives people false confidence that they think, oh great, I've had a negative test, I can run around and see my grandmother, when potentially that person could well be highly contagious. So it's just interesting to see that it actually globally recognized bodies have stepped in and said antigen testing is not a suitable mechanism for certain types of testing, such as screening and travel. Pool testing is something that we've developed really specifically with the travel industry in mind. One of the big advantages of pool testing is it allows you to get volume of people through testing far more quickly, and lowers the cost substantially. It works very much that you put people into groups. In this example, we've used groups of 6, but for the travel industry, we see it far more as being family groups would be the obvious groups to put into a pool together. You swab everybody separately, then all those swabs go into one tube, which then has the buffer reagent put into it, and then it is put into the machine. So every 6 people go into one test, essentially. You then run those tests. Where they come up as negative, which are the greens, those people move on and carry on their journey. Where the test comes up red, then in theory what you do is you retest all of the people that were in that pool to discover which person actually was contagious. However, in the case of with a family traveling, in reality, that family will obviously it's very unlikely they would continue their journey and move on, because as a family unit, they would need to go back home and to self-isolate. This actually has an ability to reduce the cost quite substantially for testing. And we are actually talking to various tour operators at the moment about reopening specific destinations in the summer of next year. And the idea behind that would be that basically that you ensure that the destination that wants people to come in accepts a LAMP test as being proof that the person has a negative corona test before they travel. that person then, you then get people to come to a centre that is near the airport beforehand, go through pool testing and basically pass through on their journey. So the idea behind it is that you can actually, we've actually done calculations where you can actually run, using pool testing, one machine can actually process as many as 20,000 people in a day. So it is actually possible to get quite good scale, and we are looking at looking at probably sub £100 for a family of 4 to be able to have those tests done, because one of the biggest, we've been talking to various tour operators, and one of the biggest challenges that people see at the moment is that if you say to your average British family it's going to cost £600 or £500 extra for you to have tests done with a PCR test before you go on holiday, those people simply won't be able to do that. In many cases, it could be the cost of an extra person going on holiday simply for the testing. So being able to come up with accurate testing that is that actually works from a cost perspective is vitally important. We have this technology already for pool testing, and we're just developing the pricing model at the moment. But we're very optimistic that next summer this could be an absolutely critical piece to reopen travel, basically, for many of ordinary British families, and we're working with various groups at the moment to see how we can move that forward. I think just sort of in summary, really, about what we've just been saying about the overall testing landscape. This is a comment by a doctor from the London School of Tropical Medicine, but basically he just made the comment that the new 30-minute RT lamp tests are going to be a game changer for the travel industry, as it will allow a more efficient system where tests can be taken and results can be issued with accuracy, immediacy and certainty. So really, I think there's just like someone else backing up the fact that we personally believe that RT lamp testing technology is without a doubt a key cornerstone of being able to reopen travel, and certainly very exciting that it's now been recognised by the UK government as being a test which is suitable for the test to release. And we're seeing increasingly more countries as well accepting lamp test for entry. So certainly we believe that as next year moves forward, you're going to be seeing a lot more countries accepting lamp testing, because it provides a very neat solution for people coming into those countries. In fact, we've actually had conversations with certain people that their prediction is that the countries, the big tourist destinations that accept LAMP and come up with policies like this are likely to be the ones that will benefit most from the upsurge in tourism. Because if you're a family of 4 and you have a choice of paying £600 to go to a certain country because you have to have a PCR test, or you might be able to pay around £100 or perhaps less than that to go to a country that accepts LAMP tests, a lot of people are going to be picking the countries that accept LAMP tests. So we see this as being really, really key in terms of things moving forward. I will now hand over to Gab to talk a little bit about the technology play that's here.
Thanks, Angus. So Angus has covered quite a lot on the testing landscape there, and it's all well and good having an accurate test, but you also need to overcome a few challenges in actually issuing that result to the individual. Otherwise, it really makes all of the previous work pointless. So a couple of challenges that I'll point out initially. So the first one is pretty obvious. You need to ensure that the correct result has been issued to the correct individual. The second point is that you need to prevent a market for fraudulent certificates. A lot of the certificates that are on the market today are a fraudster's dream. They contain no anti-spoofing measures and would be very easy to replicate that with somebody else's details. And the third point is ensuring that the person that has that certificate is the intended owner of that test ultimately. And this is where technology plays its part. So it's about linking a unique individual to a specific test and then having that result issued back to that individual in a digital format that's safe and secure. It can't be spoofed and it can't be shared. And there are many initiatives on the market today that do that. Yoti is one of those. And Kieran, in your question, you bring up 2 other initiatives. One of those is IATA's Passport and the Common Project, which I'll touch on now in a second. Just to take you back a year, if I may. So a big driver in the travel industry up until February, March of this year, you might be familiar with something called One ID from IATA. So that's a program of work that effectively sought to allow people to move through airports or train ports, ferry ports with the use of their face. So reducing interaction with staff at airports and being able to use your face to authenticate who you are at key checkpoints. Can you just nip back 2 slides for us, please, Angus? Thank you. So how does that work? So before I travel, I share my advanced passenger information and my facial biometric with the airline I'm traveling with. And that creates something called a token when it's combined with a boarding pass. When that individual then arrives at the port, that token is within the airport infrastructure. And then when I arrive at the key checkpoints, I simply use my face to authenticate who I am. So an example of that would be a bag drop or boarding the plane. And there are lots of trials that are ongoing around the world that are actually using this at the moment. It increases speed of throughput, it reduces human interaction and allows the passenger to have a really seamless journey. And then that can be used en route to collect a hire card, can be used to check into a hotel and lots of other things where you need to prove who you are. Clearly the landscape changed in March of this year. If you can go to the next slide, please, Angus. And now the airline and the government or the country you're visiting needs additional information. And that clearly is a COVID-19 result. More specifically, the fact that you've had a negative result within a certain time period is a test that's of a certain type that meets a certain set of standards. And it's really simple to add this set of information to the previous information set that I spoke of. So that's your advanced passenger information, your facial biometric, and now my COVID-19 test result, provided to the airline or the train operator, the ferry company, my hotel, before I actually make that journey. So that's where the technology comes in. In order to do that, you need to be able to attest that result to somebody's specific identity. And that is where technology such as Yoti comes in with a digital wallet. It's where the IATA passport comes in. And it's also where the Common Pass app, which is part of the Common project, comes into play as well. So those are all carrier wallets. And there's a credential system that issues that result into that wallet in the first instance. So if we were to dive into that IATA or the Common project in a little bit more detail, they have a database of laboratories that are able to issue credentials, those are the test results, to the secure wallet of the individual's choice. They then have a rules engine that pretty much stipulates somebody's trying to fly from London to Dubai, as an example. The rules stipulated by the Dubai authority say that I need to have an RT-PCR test within 72 hours. It's then able to give that passenger a green or a red tick based on the result they have, or the test they have. So if they've had a lab test for Dubai, for example, it'd be a red tick. They're not able to travel, they don't meet the requirements. So that's what our framework's looking to achieve. And it's looking to also be interoperable so that the IATA health passport can interact with Common Project and various other wallets, so that it's interoperable to give the passenger a choice. And then what that will allow you to do through an airport is when I arrive today, I don't have to present myself to any physical member of staff. I simply interact with a checkpoint in a touchless way, use my face to authenticate, so I'm limiting interaction where we need to social distance as best we can. Equally then, when I arrive at my destination and I check into my hotel, I can share that same information with the hotel. So the hotel can be confident that that passenger has arrived, they've had a negative COVID test result within, let's say, 72 hours, and they can share that seamlessly with that company. Next slide, Angus. Back to you.
Okay, yeah, thanks, Gav. Very, very informative there. Yeah, so just giving a very quick summary of the Frank's test that we basically have here with GeneMe UK. It is an RT lamp test. Basically, it can be processed within 30 minutes and the cycle in the machine. It's a highly accurate test with a very low limit of detection, as things I already mentioned. And we've got a lot of experience of working in terms of point of care testing. We actually we opened the first theatre show to reopen in the UK in the summer following the first lockdown, where we worked with Sleepless in Seattle, and we actually created the concept of taking PCR machines on site and actually testing the cast and crew of that show, which enabled them to be able to go ahead and rehearse in a non-socially distanced manner. That's now been adopted by many theatre shows, and we're working across Theatreland. Also very, very active with film and TV entertainment companies, because again, it's vitally important that they're able to sort of rehearse and put film and TV production back on in a non-socially distanced manner, particularly for the cast. So we've got a lot of experience of actually going on site and basically getting testing done as close as possible to where the work's being done. We were involved in the Heathrow trials, and we're also work with Virgin Atlantic in terms of testing their crews. So we've got a lot of experience in that space. We're working with a variety of other partners within the travel space, working on plans to help get travel reopened, as well as a lot of corporate companies, employers, all of whom are keen to use accurate yet rapid testing in order to reopen workplaces and get travel back running again, essentially. And that brings us to the end of our presentation, essentially. So we'll now be here ready and able to take any questions that anybody may have.
Thank you both. Thank you for that that great overview and breakdown of the different testing options on the market and how they are applicable to travel specifically. We've had quite a lot of questions coming through. I know some of them you've been answering as we go through. Debbie Flynn, our managing partner, had a question. Is testing expensive? And in your view, do you think this will deter holidaymakers from booking, given the added cost? I know you've touched on pool testing already, but just in the interim, what that might look like.
Yeah, I mean, testing can be expensive, and I think it's really important for to get the price down to basically reopen travel, particularly. When you're looking at different sorts of testing, there are different scenarios, and what's acceptable for a employer to pay, for example, because they want to reopen a workplace, may not be acceptable for a family to go traveling. But PCR testing is very expensive. I mean, it's an average of around about £150 a time. In many cases, it's more expensive than that. There is talk of PCR testing coming down, but when people I talk to, say that if you got to around £100, you'd have done well in that space. So clearly, that is going to be a barrier to people going on holiday who are obviously concerned about costs. So lamp testing is generally cheaper. It depends on how lamp testing is done, basically, as to whether you've got a point of care set up somewhere or whether somebody is coming along to a centre to have a lamp test done. But generally speaking, a lamp test could probably be done for between £50 to £75, maybe less than that, depending, as I said, on the circumstances. And a pool test could be sub £25 a person, could even be as low as £15, depending on the circumstances of what's been set up. So there's no question cost is going to be a critical issue in terms of getting large numbers of people travelling again. And so it's important that tests are used, that the price can be brought down to help that.
Great, thank you, Angus. Another question from Talene Vandermeer from the Malta Tourism Authority. What are your views on travellers also being tested mid-holiday, either in resort or in the destination, and what are the pros and cons to this?
Well, I think that can work very well, but obviously it's important that there's a testing structure in place where somebody is visiting to do that. Basically, I mean, I think, funnily enough, that could be an environment where an antigen test may actually have a role to play within that, because you could have a quick test on site to be able to quickly discover what to see whether or not you have the virus. I mean, you do still have the questions though as to the accuracy of that test in that environment. But it's having a test obviously mid-holiday does certainly help keep things under control in terms of people understanding whether they have the virus or not, and what they then need to do. Of course, it could also add an additional complication that if somebody tests positive when they're away, then they're going to have to they're going to have to follow the rules of that country in terms of what isolation may be required for that. But certainly, it's something that could be looked at. Gav, you got any opinions on that one?
Yeah, I agree with Angus. I think that's where antigen testing has a place within an overall testing strategy. But I think a lot of thought needs to be given to implementing that kind of regime. It will depend on the country you're visiting. Clearly, if a UK family is visiting the Canaries or somewhere in Europe, there's likely to be good infrastructure where you can potentially implement that kind of system. But we need to also consider some other destinations, Asia Pacific, Africa, that people may be, where it just isn't going to be capable to implement that kind of system. So I don't feel it's kind of one size fits all in this. So it needs to be more of a risk-based approach.
Okay, great, thank you. We had another question from Kieran Tobin about how widely LAMP testing will be available regionally around the UK. That also plays into another question that we've had around, can you walk into, do you think in the future you'll be able to walk into a pharmacy or supermarket and ask for a Frank or a LAMP test of any kind?
That's an extremely good question, and we certainly are in conversation with people in that space very, very actively at the moment. This is kind of answering both questions at the same time because they do interlink, but we are in conversation with significant players in that space precisely to set up the kind of regime that the questioner has asked about. In terms of being widely available, we're certainly looking at setting up. We already have a testing centre in London, basically in Soho Square. So we've set that up. We're actually planning on opening up a second London-based testing centre in White City in February. And we're looking at expanding into various other partners too. With regard to travel specifically for different destinations, we're looking at setting up testing centres near certain key airports. So we'd be looking at the moment, we're looking at Gatwick, Manchester, Birmingham and Glasgow, that we'd be looking at as a possibility for that. And we are in active conversation. So the short answer is yes, we do very much envisage a time where LAMP testing will be available quite widespread for people to get it. It could be very widespread indeed.
Great, thanks, Angus. Another very good question from Pip Casey. Given LAMP tests work immediately, then why do we have to isolate for 5 days as part of the release system?
Well, that would be a question to address to Grant Shapps and his group. I suspect it's erring on the side of caution, essentially. Erring on the side of caution. Yeah.
They've set that 5-day, but there's their best guess on incubation period. So if somebody was to contract a virus on the flight home, for example, they would pass a test should they have that taken straight away at Heathrow or Gatwick, or where your arrival point might be. So the intent of that is you go home, you isolate for 5 days. That if you've caught the virus, that should give it sufficient time to incubate in your system such that you have sufficient load, therefore to show up on test, as Angus described earlier. So that's where that 5-day period came from. There was initial conversation about testing immediately on arrival and then 5 days later, but the test immediately on arrival is likely to be negative should you have caught that literally hours before on a flight.
Okay, great. A quick one from Richard Turner. I think this applies to when the government released the approved testers on the 15th of December, correct me if I'm wrong, but where in central London will passengers be able to take a test that's acceptable for destinations such as the Canary Islands?
So
sorry, Gav, go on.
You can take a test at Heathrow right now. There is a facility there, and we are in conversations with them to also offer the Frank test in that facility. That's a LAMP offering. You can also take a PCR test on the high street right now, which is also acceptable within the Canaries.
Okay, great.
Yeah, sorry, just to add to that, we're actually in the process of organising a pilot with a significant partner that will be in a position for people to, there'll be a variety of destinations across London very, very shortly that people can go to organise a LAMP test.
Okay, great. And now that LAMP tests have been accepted by the UK government, how long will it be before every UK airport has this testing facility? Again, I'm not sure one that you guys can answer, but care to give it a whirl?
A lot of that depends on the appetite of the airport, the destinations they're currently serving, what the demand is for flights out of those airports. So, I fear that a lot of the smaller regional airports will probably be a little while longer before we start to see that spike. Certainly, your kind of major hubs, so your London, your Gatwick, your Manchester, your Luton. There are testing facilities at both Heathrow and Gatwick at the moment. Manchester will soon be coming back online with a facility. Now they're not in that tier 3, although I think they might have gone back in that today. So it's not a simple one to answer. It kind of depends on a number of environmental factors as well. Then there's also the availability of people to manage those services and the availability of tests within there. There's not an endless supply of tests in the back garden. So there's also supply chain from the test manufacturing to take into account as well.
Yeah, that's very true. As Gav said, we have been in contact with and spoken to a large number of airports across the UK. So there are conversations ensuing, certainly about what, in theory, could be done. I think, obviously, as Gav said, a lot comes down to the destinations that are being served. So, for example, some of the work we're looking at modelling for next summer is from airports that have large amounts of package travellers to certain key destinations that will accept LAMP, for example. So all those things are key. But also in terms of supply chain as well, Gav's touched upon an absolutely critical point, and one that we actually have done a great deal of work on ourselves, because one of the critical things about any form of test is it scalable? Basically, are they in a position to be able to roll out to multiple destinations and have the supply to do that? Because PCR tests particularly need certain reagents. There's a lot of demand for those reagents at the moment in the global chemical markets, which is causing some challenges. With Frankt, we actually have developed a relationship with one of the world's largest lyophilization companies. Lyophilization effectively means freeze drying, because our reagents need to be freeze dried, or part of our kit needs to be freeze dried. So this company actually has a very large capacity to be able to deliver. So we've actually managed to secure for ourselves, moving into next year, an extremely robust supply chain. In fact, we certainly believe that we have one of the most robust supply chains of any test manufacturer in the LAMP space whatsoever. So we would be very confident of being able to fulfill any level of demand moving into the summer of next year for sure.
Just one other I touch on that topic is I think we need to consider the different types of traveller when we consider where they might take a test. So if you just broadly split it into a business traveller versus a leisure traveller, a business traveller may well be satisfied to wait until they arrive at the airport to take a test. It would need to be a LAMP test in that case, because if they do have a positive, then they're not going to be able to get on a plane and make their business meeting. But if you take a family that might be going on their annual trip, there's probably going to be a lot more nervousness around what that result would be. So they're probably going to be more likely to take a test 48 hours beforehand at a high street branch, like Angus has kind of referred to, and have the satisfaction that they know they've all got a negative test and they can travel to the airport knowing that they're going to get on that plane and go on holiday for a week or 2 weeks, whatever that might be. And that latter kind of scenario also takes pressure off the airports. They have a limited amount of infrastructure in order to set these systems up. And whilst they are doing that now, because they can, the load factors are really low, so the terminals are not busy. But that, as we start to see passenger volumes increase again, that is going to start to become a factor.
Yeah.
Okay, great. A few more questions coming in. Julia from the Advantage Travel Partnership, do you anticipate a globally harmonized approach? Can this be achieved? Do you think this should be government or industry led?
That's a great question. So, if you look at the standard passport across the world at the moment, it's still not unified. So I don't know. That's a really difficult question to answer. There needs to be as much commonality as possible in order for global travel to reopen. Otherwise, it's going to be a confusing landscape with different standards required for different destinations, and ultimately only the travel industry is going to lose out in that scenario. So there is a lot of work going on with organisations like IATA and ICAO to try and drive standards and commonality. But it is down to a government level as well. It's the government that's going to determine what they're going to allow to cross their borders. So I don't know.
Great. Tricky one.
What's your view, Angus?
Yeah, I'd say, everything Gav said there, I completely agree with. It will come down to, I think, the work that trade bodies are doing at the moment to try to get a standardised approach to that. But it would obviously make life a lot easier if there was a standardised approach to it. So, yeah.
Okay, a couple more questions. If the Oxford vaccine, or indeed any of the other ones that are in progress, become mass distributed, do you see a need for LAMP tests, or will they get phased out?
Well, they will eventually get phased out, but I don't see that happening anytime soon, basically. Particularly in the world of travel, you've got to get to a point where basically the globe has been vaccinated and COVID-19 ceases to be an issue anymore. It goes down into the sort of environment that we currently have for the flu, for example. So vaccines will obviously be great. They'll help a great deal, but there's been quite a lot written about this. But there was a piece on the Huffington Post, actually, I think yesterday, that was a really, really good piece on this very point. But, you know, testing will actually, I think in the short term, be even more important, because it will be a critical part of managing that process as you roll vaccines out. I think I said at the very beginning of the presentation, there's still many, many unknowns here. You know, how regularly will people have to be revaccinated? What does the vaccination actually mean? Does it mean that an individual won't get sick from COVID, but could still be a carrier and pass it on to other people? How many people don't take the vaccine, for example? In reality, how quickly can it be rolled out? You know, how many people in other countries have had that vaccine? There are many, many unknowns and variables. McKinsey wrote a report, I think it was last week or quite recently anyway, that was basically talking about their prediction is it will be Q3 to Q4 of 2021 before businesses should really expect to be seeing anything like a return to normality, based on where we are at the moment. And that's based on a lot of successful factors happening. So great news about the vaccines, but certainly, you know, the general viewpoint is that testing is a critical piece of managing the vaccination process to understand how effective it's actually being in controlling the virus. So yeah, we think there'll certainly be, for some time to come, this will be a big factor.
Okay, great. And I think, just final question, a few people are asking about the Frank Soho Square testing centre. I think this is to the point about working with pharmacies, et cetera, So any comments?
Yes, I can indeed. Yeah, I saw those questions. At this present moment in time, the hub is purely working with employers, basically, who we're using it as a hub to basically test employees of companies. However, obviously with the news, the recent announcement about test to release, we're obviously very much working to be part of that and be on the list of approved suppliers. So we are going to have a solution essentially for the general public to be able to participate within that process. As I said, we're opening up a second lab, and we are also working with some key partners where basically you'll be able to go and have the test basically be swabbed, and then the test will be processed. So at this present moment in time, no, we're not having members of the public coming into Soho Square, but that situation, there will be a solution for that very shortly as part of this process.
Great, thank you, Angus. Could you just scroll to the next slide, please, Angus?
Yes, of course.
I think that's all the questions, so thank you to everyone for sending those in. If it's maybe just back one, yeah. And we've had a few people asking about, can they get a copy of the recording? Yes, absolutely. We'll be sending that out with a bit of a sort of 101 graphic and some sort of easy bite-sized takeaways for you. So we'll send that across to everyone tomorrow. Any other questions, you can contact myself or the team at Fin Partners. We're at GeneMe UK at finpartners.com. And of course, you've got Angus and Gav's details on the screen there, so you can get in touch with them directly as well. So I think that's everything. Thank you, Angus and Gav, for hosting today's workshop. Thank you both. That was very insightful. I think it's definitely helped put a lot of the nitty-gritty detail into perspective, and how that sort of practically rolls out for the travel industry. Lots of people asking about where they can get tested. It's definitely in our travel industry blood. So fingers crossed we'll all be traveling again very, very soon. So thank you very much to both of you, and thank you for everyone for joining. Have a good afternoon.
Thanks very much indeed, Kate. Great stuff. Appreciate it. Thank you. Okay, goodbye.
Thanks, everyone.